Israel says it will reduce aid into Gaza after accusing Hamas of violating the ceasefire deal. Argentinian President Javier Milei praises President Trump for his peacemaking efforts during his visit to the White House. And Madagascar's military takes control of the country following anti-government protests that forced the president to flee the country. The French Prime Minister, Sébastien Lecornu, has told Parliament his government will suspend unpopular pension reforms until after the 2027 presidential election. He made the concession as he set his budget priorities after a week that saw him resign, only to be reappointed. He urged lawmakers not to use the budget as a pretext for a no-confidence vote. The pension reforms, which raised the retirement age to 64, were forced through in 2023 despite massive opposition. And a man in the U.S. pled guilty Tuesday to attempted murder for firebombing the home of Democratic Pennsylvania Governor Josh Shapiro. He now faces between 35 and 50 years in prison under the plea deal. Corey Balmer said he had hatred towards Governor Shapiro. In April, he threw a Molotov cocktail at the governor's official residence. One of the world's longest dinosaur trackways, dating back 166 million years, has been found in southern England. The new path, discovered at a quarry in Oxfordshire, stretches for 220 meters and is made up of 100 footprints, each a meter wide. The marks were made by a giant four-legged sauropod as it made its way across what at the time was a patchwork of tropical islands and lagoons. It is the latest dinosaur track to be revealed at the quarry, which has been described as one of the world's most significant dinosaur superhighways. The World Health Organization is calling for urgent action to tackle the growing burden of neurological disorders, which are now causing 11 million deaths worldwide each year. In a report released Tuesday, the organization says less than 1 in 3 countries has a national policy to address the growing burden of neurological disorders. This is despite the fact that more than 40% of the global population, over 3 billion people, live with neurological conditions. The World Health Organization report also says that low-income countries have more than 80 times fewer neurologists compared to high-income countries. I spoke earlier to Nirja Chowdhury, technical officer and researcher at the World Health Organization. Nirja, can you tell us a bit more about the types of neurological diseases that are detailed in this report?
We include a host of neurological conditions. As you probably know, there are a heterogeneous group of disorders. In this report, what we present is, in fact, the top 10 neurological conditions, which are stroke, brain damage in the neonatal period, migraine, Alzheimer's disease and other dementias, nerve damage due to diabetes, meningitis, idiopathic epilepsy, neurological complications associated with preterm birth, autism spectrum disorder, as well as nervous system cancers. In fact, we report this burden of neurological disorders, which is alarmingly high. And in that group, we include 37 neurological conditions. So it is a wide spectrum. And it basically tells us that these conditions are, in fact, the leading cause of ill health and disability worldwide, affecting a third of the population.
And people are dying from these diseases. Why is that happening? Right. What is behind this?
I think there are many reasons for this, and these we've elaborated in the Global Status Report on Neurology. I just told you about the large burden, but in fact, the response and the political prioritization given to neurological disorders is insufficient. In fact, in our report, we found that only a third of countries actually have policies that have neurological disorders included in them. Also, what we find is that only a third of countries actually include these disorders in their universal health coverage package. So people are not getting the care they need. Either there are not enough neurologists around, not enough specialists, or there are medicines that are not available in many parts of the world. Even when available, these are expensive. Also, people with neurological disorders face a lot of stigma. They get neglected, they are ostracized, and they basically denied their basic human rights.
So Nirja, how do you expand care in countries where they don't have the adequate reaction and services and doctors, as you said, to be able to treat these diseases?
One of the important things we can do and we should do so that people everywhere have access to care is, in fact, expand the neurological workforce. So we can train non-specialists who work in primary care, for example, to detect neurological diseases and provide treatment for these. We also need to remember that we need to support carers of people with neurological conditions, and they are often neglected. So we need to have support systems in place for carers, and we need to ensure that medicines are available in countries, and services are available not only in urban centers, but also in rural areas and in non-specialist settings.